Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. There have been several exciting recent developments regarding the approval of drugs used to treat early Alzheimer's disease. And here to discuss is Nikhil Palekar, MD, Director of the Stony Brook Center of Excellence for Alzheimer's Disease and Director of the Stony Brook Alzheimer's Disease Clinical Trials Program. Thank you for being on the show, Dr. Palekar.
Thank you so much, Kimberly, for having me on today.
So why don't you tell us about these new drugs to treat Alzheimer's and what they are and how they work?
So this is really exciting stuff, right? So this is a group of medications called monoclonal antibodies that target the amyloid plaques that start to build up in the brains of patients with Alzheimer's. Amyloid plaques start to accumulate roughly about 10 to 15 years prior to the onset of symptoms and is noted to be one of the main core features of Alzheimer's disease. And now we have not one, but two new medications, lecanemab, which was approved in June of last year, June 2023, and now we have donanemab, which was just approved about a week ago. And both of these medications go and bind to these amyloid plaques in the brain and remove them completely from the brain, thus slowing the progression of symptoms in patients with early stage Alzheimer's.
It's been a polarizing reception, if you will, to these drugs, met with hope on one end. Some people are very skeptical about it, specifically when it comes to side effects like brain swelling.
So one thing to note is these medications do not stop the progression of the disease or reverse symptoms. They do slow the progression down. On average, lecanemab slowed the symptoms down by about 27%, and donanemab in the clinical trials showed that it can slow down these symptoms by about 35%. But then the question comes to the side effects. And one of the side effects that is worrisome is called ARIA, A-R-I-A, which is caused due to the removal of these amyloid proteins. And what happens is there's so much of amyloid protein being removed that these small blood vessels of the brain can pop, causing some swelling as well as at times some microhemorrhages or microbleeds, very, very, very minute. In the trials, what was found that more than upwards of 90% of patients who developed this ARIA symptom or side effect did not have any neurological issues or cognitive deficits. It didn't make their symptoms worse, and it resolved spontaneously on its own. Yes, we need to monitor for this, and we do that with MRIs. But we want to make sure that we also look at the risks and benefits in the situation. And it seems like the benefits of slowing of the progression of the disease do outweigh some of these risks if they are managed and monitored carefully.
Well, one of the interesting things about the drug is that once it removes the plaque, they're saying that you can come off the drug. Is that true?
Yes. So once the group of patients reached the amyloid levels in their brains were negligible or pretty much undetectable with the PET scan, they stopped them, but they continued to follow them up. And it seemed like they still showed an improvement in terms of slowing their symptoms. So based on this information, I guess we can safely say that if a patient's amyloid levels are below detection, it might take 6 months. In some cases, it might take 12 months. But then the patient can actually stop taking this medication and still benefit from the slowing of the symptoms for many more years to come or many more months to come.
Your Center of Excellence for Alzheimer's Disease was also the first, I guess, to successfully use another different treatment.
Yeah, so we were the first on Long Island to provide our patients with the medication lecanemab, which was approved last year. It works very similar to this new medication, donanemab. It also goes and binds to the amyloid plaques.
These amyloid plaques, I mean, where do they come from? How do they start building up in our brain? I mean, is it just unavoidable as we age? It's just naturally going to happen to all of us? Or are there specific, I guess, lifestyle factors that go into the buildup of these amyloid plaques?
We don't really know why some people have the amyloid plaques building up in their brains and some do not. All of our brains have the amyloid protein. It's a protein that's essential for the functioning of the brain. But for some reason, this protein, which normally gets cleared out of the brain when we sleep, stops getting cleared out and starts to form clumps and plaques, as we call them. And this gradually keeps accumulating for a decade or two. And once it reaches a certain level, you start to see the symptoms of Alzheimer's, which is typically memory loss, short-term memory loss. Now, there are some genetic risk factors that we do know if patients have specifically a genetic risk factor called the ApoE4 gene. And if you have the ApoE4 genetic variant, you are at a much higher risk of developing Alzheimer's. Your risk increases almost 10 times. And so this is something that we know and we can look for. But there are also people who do not have these genetic risk factors and still develop Alzheimer's. Age is definitely a risk factor because we see as people age, the rate of Alzheimer's keeps increasing.
Now, cost is something that prohibits most people from being able to obtain some of these prescriptions. Can you talk about that? And is this particular medication covered by insurance?
Affordability is really important, and these drugs are expensive.
Right.
So let me start with the medication that was approved last year, lecanemab, and the cost for that annually was $26,500. But the total cost of the treatments for a year, which includes multiple MRI scans, PET scans, some blood work, and the infusion itself, the total of that comes to close to $100,000 a year. The majority of our patients are on Medicare, being 65 or older, and so CMS has been covering the cost for the infusions, the cost for the drug. They cover 80% of the drug cost. The remaining 20% is often picked up by supplemental insurance. So we are hoping the same would happen with the new medication, donanemab, that was approved last week.
Well, hopefully good news is on the horizon. Thank you so much, Dr. Nikhil Palekar, for being on the program.
Thank you.
We'll have more after the break. You are watching American Medicine Today.
The loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent.
Walk like that in a while. I don't remember how long.
I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com.
My name is Kenneth Wood. I've been a contractor for over 34 years. Unfortunately, I've been very brutal on my body. For years, I've had lower back issues. The last few months, I've taken on some projects that required a lot of bending and pulling, caused a herniation of the disc. And, it didn't matter what I tried to do at that point. The damage was done. My butt muscles were always clenched up constantly, 24/7. It's just so uncomfortable. It's hard to sleep. It's hard to walk. And it just progressively gotten worse to the point where I couldn't work no more. And in my head, I'm thinking I can get through this and just go to the chiropractor. It was like putting a Band-Aid on it. And then 6 months later, I was hurting again. I refused to take medicine, so I finally had to break down and get the MRI. And that's one thing I was afraid to get an MRI because I knew it wasn't going to be good. I've had so many friends that have been through back surgeries and stuff, and they're just walking bent over, they're still hurting, and I didn't want to go that route. I've seen Bonati's commercials for years, and every time I seen it, I tell my wife, one day I may have to go, and if I do, that's where I'm going.
Surgical guests of the Bonati Spine Institute are often surprised by how efficient the process is from the initial contact to them headed home post-surgery.
The time that I first called Bonati's and we started setting things up, it only took a day, really, on the phone with the ladies to explain things to me. Within 4 days, when I had set the appointment up for the surgery, we drove 14 hours to get here, came in Monday morning for evaluations, Tuesday surgery. I was able to look over and actually watch them do the work they were doing into my back. I could communicate and let them know if I was feeling any pain shooting down my legs or anything like that.
No pain here.
No, sir.
No pain here.
No, sir.
No pain here.
No, sir.
They allowed my wife to come in for the procedures. Nobody does that. And when your loved one's going through stuff like this, they want to be a part of it. They want to know you're okay. And that gave her peace of mind. that she was able to be in there and experience it with me. She wasn't left in the dark. So that was awesome. Yeah. Tomorrow morning, which would be our 4th day, I'm getting back in my car and going back to Texas, going back home.
Immediately after the exclusive Bonati Spine procedures, patients are asked to get up and move in the recovery room before being released to return to their hotel or home if they live nearby.
As soon as the surgery was over and they had me in recovery, which was like so fast, I was walking and I ran from one side of that room to the other like 3 or 4 times. And I was like, I couldn't have ran 2 weeks ago. There's no way. The pain that was shooting through my lower back was unbearable. So for him to tell me to run, I'm like, what? You want me to run? Okay. So I started running and, I wasn't sprinting, but I was moving way better than I was before I came in here. Dr. Bonati Institute has changed my life. If you're fighting with this, you need to at least call, contact, do the consultation.
At the Bonati Spine Institute, there is no need to wear uncomfortable braces or go through time-consuming physical therapy. Instead, patients are prescribed a walking regimen of about 40 minutes a day.
There's no suggestion of back braces or nothing like that. They wanted me to go home and just kind of be natural and just get back to life cautiously, because we did just have surgery, so it's going to take some time for that to heal. I haven't needed bracing. I haven't needed a crutch. I haven't needed a walking cane. I literally got up out of that bed and walked to my car and went home.
Ken is looking forward to getting back to work and spending quality time with his wife again.
Getting back on my Harley with my wife, that's our time, and we haven't been able to do that. And if you love your wife, set your pride aside and do what you got to do to be the man that she needs you to be. And it's an eye-opener for me. And same as most guys, I'm tough, I'm Hercules, I'm fine. No. If you want to be 100% all you can be for your family, not just your wife, but your kids, seriously contemplate coming here, because this will change your life.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati, and we'll be discussing conscious IV sedation. Why is that such an important feature of the Bonati Spine procedures?
When I started my practice in orthopedic surgery, initially I did fractures and backs, and in the process doing backs, I did open surgery. Every time that I did open surgery, one of the major concerns was the time that we invest taking the patient under an anesthetic. Mm-hmm. Not only the complications that can happen post-operative time, that is usually that elimination of the anesthetic through the liver, create some types of some abnormalities in older people.
Right.
So the concern about the treatment was not only associated with the difficulty of the surgery, mm-hmm. the time that consumed this patient under anesthesia, and the recovery of this patient post-surgery. We eliminate the ones that I believe they were the ones that impede the patients to be treated.
All right.
For example, there were people that they have some liver problems, mm-hmm. people that they have heart problems, and the anesthesiologists always fought about these patients shouldn't have surgery. But at the same time, this patient has so much pain that we need to do some solutions. And then they were treated in different ways that they were not really successful.
Okay.
So
and that's due to general anesthesia. That's why they weren't good candidates.
Exactly.
Okay.
I start to think, how about if we treat these patients in a different way? Mm-hmm. And that's when I start to see we need to minimize the incision. We need to minimize the damage to the bones, to the ligaments, and to the muscles.
Right.
So we can create access to the area, operate these patients without really the roadblocks of general anesthesia. That was an initial part how I developed those tubes to do a surgical procedure using an arthroscope and using the tubes to arrive directly to the area where the problem was located.
All right.
But when I did that, we're still being using general anesthesia. Well, I thought that if we block the skin and then we block the fascia, probably we can put the tubes inside without creating pain.
Anesthetize those areas?
Yes, use some
Okay.
anesthetic in that area like xylocaine.
Sure.
A minimal amount, maybe around 5 cc's or
Right.
something like that.
Okay.
When we did that, I realized that cutting the skin was not a problem because it was numb.
Right.
Numbing the fascia remove a lot of discomfort because the fascia is very sensitive.
Right.
So when we numb those areas, we were able to put the tubes to the area that we need to operate. But at that time, also we have another important element, the bones. And when we touch the bones, that was pain. The problem was, well, we need to numb the periosteum in this area. So we put some very small injections on the periosteum, and we found that to our surprise, that we can do surgery where we can use the instrumentation and the patient is not going to have pain.
Right.
But the beauty of this is not only he's not going to have pain, but also he will be able to talk to us, will communicate with us.
So they're slightly sedated, but they're able to communicate through the entire procedure with not only you, but the rest of the surgical staff.
Yeah. By the 90s, we already thinking in that's how we are going to treat this.
Right. So for more than 30 years, you've been doing that.
After 80,000 procedures performed,
Right.
a lot of this one was just think in the medical society that is a way to do it. And today, different specialties start to test that technique.
We are going to take a quick break. We'll be right back with Dr. Bonati talking about conscious IV sedation.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
We went to the Bonati Institute, and that was the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know? So 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was rolling with everybody, and I'm in the advanced class. That sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. We're in the middle of discussing conscious IV sedation, but they can still feel if you're at the root cause of their pain, and that interaction during your surgery is what brings about the incredible results, because you said, is this your pain? And they're able to locate it. Yes, this is it. And then you go and you take away the impingement, you make more room for the nerve, and suddenly they go, pain is gone.
The patient becomes the owner of the body, is telling you what you are doing.
Right.
And if what you are doing is helping or not.
Mm-hmm. And not only that, they're able to watch and they go, oh, that's what was causing me that agonizing pain. Yet if they were put under general anesthesia, they would never know.
Usually the general anesthesia still is necessary when you need to do procedures like open surgery in the spine.
Mm-hmm.
And unfortunately, people continue doing fusions. And you know my feelings about fusion. Not only I don't think they don't work, I think they are a situation where the recovery for the patient takes too long.
It does.
So you don't never know if the surgery worked for you or not because you are in so much pain for so long that you expect that this is part of the treatment. And the real truth is with our procedure, the patient is walking 1 hour after the surgery.
Right. And we'll talk more about those procedures and the incredible 98.75% patient-reported satisfaction in another episode. Thank you for watching American Medicine Today. You can check us out anytime, anywhere, if you search AMT on all your streaming platforms. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.